Good morning, everyone. My name is Navneet Kaur, and here is my student ID card. So, today I'm going to present a case study about Amara, who was diagnosed with stage 3 invasive ductal breast cancer. So, I will explain the disease process, risk factor, symptoms, diagnosis, and some possible complication related to her condition. So our first topic will going to be the pathophysiology and some risk factor. So Amara was diagnosed with stage 3 breast cancer, especially invasive ductal carcinoma, which is the most common type of breast cancer. So this type of cancer began in the milk duct and separate into the surrounding breast tissues. So in Amara's case, the cancer has also spread to nearby lymph nodes and surrounding structure, including the chest wall. So the pathophysiology of breast cancer includes the uncontrollable growth and multiplication of abnormal cells caused by genetic mutation that interfere with normal DNA repair. And Amara has a BRCA1 gene mutation, which significantly increase the risk of developing aggressive breast cancer. So, well, basically, the BRCA1 gene act as a tumor suppressor by repairing damaged DNA. However, when this gene is mutated or damaged, cells are not repaired properly, allows abnormal cells to multiply uncontrollably and form the tumor. So, following the removal of Amara's axillary lymph node during her surgery, she is at risk of developing lymphedema. So, lymphedema occur when a lymphatic drainage is disrupted or leading to accumulation of protein rich fluid within the tissues, and damage to lymphatic cells during the surgery can even impair normal drainage and result in swelling and inflammation. So some of the Amara's risk factor in her case will be like associated with breast cancer are significant risk of BRCA1 gene mutation, which increase the lifetime risk of breast cancer. So other non-modified risk will be female gender, increasing age, and possible lymph node involvement. To complications like lymphedema, and even Amara has no known family history of breast cancer, but BRCA1 mutation can still occur in individual without a family history. So yeah, our next topic will be the pain management and the interventions. That will be the pharmacological and non-pharmacological. So first is the pharmacological intervention, which is the provision and evaluation of prescription analgesia following mastectomy surgery, and acute postoperative discomfort is frequent following breast surgery due to tissue trauma, inflammation, and nerve irritation caused by axillary lymph node dissection. So Amara's complaint of pins and needles in her armpit, pointy neuropathy pain induced by nerve damage during the surgery. So, what nurses should do, they should use an evidence based pain assessment instructions on a frequent basis and following medical recommendation when administering prescribed analgesics. So, effective pain management, increase patient comfort, mobility, and recovery while lowering the livelihood of chronic postoperative pain syndromes. So, nurses should aware about this. And if we talk about the non-pharmacological intervention, they may include the positioning and post-operative arm mobility exercises are primarily non-pharmacological interventions. So patient frequent report stiffness, limited shoulder mobilities, and discomfort after mastectomy and lymph node surgery. So according to New South Wales Health, the post-operative breast surgery treatment should include the teaching and supporting for movement, rehabilitation, and wound care. So even early mobilization, increased circulation, facilitates the functional recovery and decrease the consequences like lymphedema and shoulder dysfunctions. So our next topic for Amara's case will be the wound care management. So, our one priority nursing intervention is regular assessment and management of Amara surgical wound and wound drainage. So, following modified radical mastectomy, Amara has two wound drain in situ to remove her excessive fluid and reduce risk of seroma formation. So nurses' care includes the regular assessment, assessing the wound site and drain in section points, monitoring drain output, checking for any signs of infection such as redness, swelling, warm, and increased pain and any discharge, and maintaining strict aseptic techniques during dressing changes and drain management, ensuring drain are not blocked. So these all intervention help in promoting early detection of complications such as and complication and support proper wound healing and reduce any risk of infection. And that's all about wound care. Next will be lymphedema prevention. So, lymphedema prevention and monitoring are the second key intervention in Amara's case. So, Amara is more likely to experience lymphatic drainage issue and arm swelling after having her axillary lymph node removal. So, what nurses care includes, it includes the checking for swelling, heaviness, tightness, and decreasing arm movement, and monitoring for early signs of infections, educating to avoid injury or pressure on the affected arm, and encouraging gentle range of movement exercise to maintain the circulation, promoting skin care, and protect to avoid infection, which can worsen lymphedema. So yeah, nurses should teach Amara about her arm exercises, avoiding the blood pressures, infections, and traumas. So this will all help in maintaining lymphatic flow, reduce fluid buildup, and prevent long-term swelling and disabilities in Amara's case. And our next topic will be the discharge education and the multi-disciplinary team support. So, falling to right modified radical mastectomy, discharge education is crucial for a safe recovery and the avoidance of problems. So, our main will be the wound and drain care is the top priority for Amara, and this includes keep an eye on output, keeping bandage clean, and supporting infection symptoms such as redness, swelling, discomfort, or discharge. And Amara's axillary lymph node excision can limit lymphatic outflow and increase and induce swelling. So, thus, it's critical to prevent lymphedema and preserve arm mobilities. Amara should also require continuous multidisciplinary team support because of her condition. So Amara basically required some multiple health professionals such as breast care nurses. They will be providing ongoing education, wound care support, emotional reassurance, and physiotherapists helping their mobility, posture, and exercises. Oncology, they will definitely help her in her further cancer management, such as chemotherapy, radiotherapies, and hormonal therapies. Genetic counselors, they support in understanding of the BRCA1 mutation and family screening implications, and social workers, they help in providing emotional support and with anxiety, body image changes, and family or financial stress for Amara. So basically, that's all about Amara's case. In conclusion, we may say by saying that Amara's case demonstrates the complex physical and psychological effect of stage 3 invasive ductal carcinoma. So effective nursing care following modified radial mastectomy require evidence-based pain management, and multidisciplinary collaboration is essential to support Amara's recovery, long-term well-being, and quality of life. So here are some of my references. That's all from my side. Thank you so much.